Medical Technology Innovation, 3D Bioprinting. Hi, I'm Chris Gallucci.
And I'm Rebecca-Slimak. Today we will be discussing 3D bioprinting and its implications for healthcare. To begin, bioprinting is the three-dimensional printing of biological tissue through the layering of living cells, with widespread application for use in clinical testing, surgical repair, and replacement of damaged or missing tissue, and eventually organ transplantation.
Let's begin with a brief history. About 15 years ago, the Department of Defense approached Dr. Stu Williams to convert an ordinary 3D printer, once used for printing metal, into one that could print biological materials. This was meant as an experiment to try and recreate lymph nodes for soldiers whose immune systems were compromised following a bioterrorism attack. The result? Dr. Williams and his team at the University of Arizona successfully created 3D bioprinted lymph nodes using the world's first 3D bioprinter, nicknamed the BAT, for bioassembly tool. The bioassembly tool perhaps is one of the most cutting-edge bioprinters in existence, and has since been replaced with the bioassembly bot, which is far more precise and uses a newer software which is much more user-friendly.
The price of the bioassembly bot starts at around $160,000, which includes the software, but it may be a while before it has universal application. The creators of the 3D bioprinter envision its use in every surgical room in the future, where a patient's fat cells can be isolated, fed into the machine, converted into cells that the surgeon needs for the surgery, printed and structured into a specific tissue or organ, and subsequently transplanted. The costs of the procedures are yet to be seen, but it is estimated that this increased efficiency may be able to decrease costs of healthcare delivery and make procedures that were once extremely expensive and unavailable more affordable and easy to obtain.
Although it has had some success, 3D bioprinting is still in its development phase as scientists are constantly seeking to improve printing methods. Currently, printing entire human organs hasn't been possible due to the complexity and problems relating to the structure and scaffolding to lay down the cells. However, smaller structures and tissues, as you'll see in this picture, which is a 3D printed capillary bed, have actually been successfully printed and used to repair or replace damaged sections of organs, skin, cartilage, muscle, and blood vessels. And actually, in recent years, surgeons have been able to implant lab-grown bladders in urethras in younger patients.
Outside of surgical uses in transplants, 3D bioprinted tissues have been used by pharmaceutical companies for drug development and testing. Currently, Organovo, one of the leading 3D bioprinting companies, sells engineered tissue such as pieces of liver for about $2,000 per sample. These samples allow scientists to carefully monitor the effects and toxicity of drugs and treatments on tissues in real time, which would not only be immensely important in deciding whether to embark on expensive clinical trials with patients, but would also save time, money, and may end up completely changing the entire process for drug approval and testing. In this photo, you can see an actual 3D bioprinted liver tissue that can be used for clinical drug testing.
The implications for the use of 3D bioprinting for the future delivery of healthcare are enormous. These include improved drug toxicity testing by pharmaceutical companies, the monitoring and study of disease progression through the introduction of disease in these simulated 3D biotissues in laboratory settings, the small-scale surgical applications such as damaged tissue replacement, which would lead to increased efficiency and better healing for the patient, as well as the ultimate goal, which would be to entirely replace defective or diseased organs. This last one is especially important since organs can be made on demand, therefore eliminating the need for a donor, decreasing patient waiting time for a transplant, as well as organs can be created from a patient's own cells and therefore aren't rejected by their immune system.
Currently, there aren't any clear guidelines or regulations for 3D bioprinting, so researchers are experimenting with bioprinting until they are told otherwise. Once the FDA does step in, it is unclear how long approval will take once research phases are complete. Some project that it can take anywhere from 2 to 10 years to get something approved, so it will probably be a while before we see widespread application of this technology. However, Once the technology has advanced enough and it is ready for everyday use in surgical rooms and hospitals across the country, healthcare will never be the same.
Discussion questions. Do you feel that it is ethically acceptable to use stem cells for 3D bioprinting? My personal view is that I don't see an ethical problem with this, especially since there are other methods of acquiring stem cells through the reprogramming of somatic cells rather than using embryonic stem cells. Even still, the amazing potential for health benefits that we outlined in the presentation overshadow any negative moral implications.
Question 2. Should the FDA have complete control in regulating the process of bioprinting if it means holding up important advances in technology? I think the FDA should be involved but not have complete control. There should be a designated length of time for approval to avoid holding up progress. While I understand they need to ensure the safe use of the products, those who would benefit greatly do not have the time to wait around.